Good morning, and welcome to the session on celebrating the role of women in Bangladesh's achievement of MDGs 4 and 5 targets and global application of the lessons learned in the post-2015 era. My name is John Clemens. I'm the Executive Director of the ICDRB in Bangladesh. And I'm delighted to have an outstanding group of speakers and then panel for discussion. Dr. Shams Arifin, Director of the Center for Child and Adolescent Health at ICDRB, Dr. Kim Streetfield, Senior Scientist, or Scientist now Emeritus, former Director of the Center for Population, Urbanization, and Climate Change at the ICDRB, and Dr. Victoria Nankabura, Senior Lecturer in the Department of Epidemiology and Biostatistics at Makerere University, and also a researcher at the University of Bergen. Well, I don't know how many of you have been to Bangladesh. Bangladesh is a country with a land area the size of about the state of Wisconsin, but with 160 million people. It's the most densely populated country in the world. It's a low-lying deltaic country sitting on the Bay of Bengal that is regularly afflicted by natural disasters, many of which from what undoubtedly is climate change. Indeed, Bangladesh is said to be the most climate change affected country in the world. It is a country with substantial poverty, and it's a country that former Secretary of State of the United States, amongst other things, Henry Kissinger, referred to as the world's basket case. Next slide. Yet, in this, amidst this backdrop, some fairly remarkable things have happened in Bangladesh over the last several decades. Bangladesh actually has already achieved MDG4, reduction of child mortality, as well. Bangladesh is clearly on track to achieve MDG5, reduction of maternal mortality, by the end of 2015. Remarkably, Bangladesh is one of only 6 countries in the world on track to achieve both MDG4 and MDG5. As well, a remarkable thing has happened to fertility in Bangladesh. In the 1980s, when I was a young scientist at the ICDRB, you can see that the average woman had about 5 kids. You can see that fertility has declined precipitously over time to nearly replacement levels. The ICDRB, where I work, is really one of the world's venerable health research organizations in the developing world. It's been around since 1960. And as such, has played kind of an interesting role in this MDG success story. Made possible, of course, in years past by the Norwegian government and presently by the governments of Australia, Sweden, England, Canada, and Bangladesh, who have supported a fairly remarkable field studies area that is operated by the ICDRB about 25 miles southeast of Dhaka, a place called Matlab. It's the first place in the world where a demographic surveillance system was created. It was the basis for the entire in-depth network. It was a place where several critical interventions were tested. For example, oral rehydration solution was developed, tested, and validated in critical studies in Matlab by the ICDRB. It was in Matlab as well that we learned a lot about vaccines that we didn't know before. For example, we found out for the first time that measles vaccine has a profound effect on child survival. Now, that seems like a no-brainer now, but it was highly controversial in the 1980s. It was also the place where it was discovered that tetanus toxoid vaccination of women of childbearing age would protect themselves and their neonates against neonatal tetanus. And it was the place where it was first recognized that the most effective and efficient way of delivering these simple primary health care interventions, as well as family planning services, was through community women, so-called community health workers. Generally speaking, young married women who themselves were using family planning methods could advise their neighbors on this, distribute contraceptive agents, as well as simple primary health care interventions, which the government of Bangladesh took to scale countrywide with remarkable effects, as you've seen and I showed you. Last year, the Lancet published a series of articles on what was called the Bangladesh paradox. The paradox is, how did all this success occur in this particular place? And in his editorial on this series, Richard Horton wrote that the ICDRB pioneered important work in family planning, immunization, and treatment of diarrhea in an open culture of innovation. The research provided reliable knowledge for health system strengthening. Of course, it's very much a woman-centered strengthening of health services. But was this the entire story? Our next two speakers will address the complexity in some ways of this great success story in Bangladesh. Shams Arifin will be talking about the success in child survival, Kim Streetfield, the success in maternal mortality, and then Victoria Nankabur will be speaking on the lessons learned and their relevance for Uganda. So let me introduce Shams Arifin.